Welcome to the recorded version of the Grantmakers in Aging web seminar, The Department of Housing and Urban Development's Policy Priority on Housing and Services, Senior Housing Strategies and the Relationship to Health, featuring Jennifer Ho, Senior Advisor to the Secretary for Housing and Services, U.S. Department of Housing and Urban Development, and John Feather, CEO of Grantmakers in Aging, from September 16, 2013. This event was made possible by a partnership between Grantmakers in Aging, the John A. Hartford Foundation, and the Retirement Research Foundation. Technical and production support is provided by the American Society on Aging.
Thanks, Steve, and welcome to everyone, and welcome to Conversations with GIA, which is our monthly webinar series on a variety of topics of importance to funders and others who are working in the field of aging. Today's topic is, as Steve mentioned, housing as a platform for health, which is a growing area of interest for many of our members. And I'm delighted that almost 500 of you have joined us for today's webinar. Before we begin, I want to thank the John A. Hartford Foundation of New York for their continuing support of this series, and the Retirement Research Foundation of Chicago for their co-sponsorship of today's webinar. I also want to thank the expert team at the American Society on Aging for providing technical and production support for the series. Housing and Urban Development Secretary Shaun Donovan has made the relationship between housing and services a priority of the department, recognizing that housing is a platform for health. We are honored to have as our special guest today Jennifer Ho, the Senior Advisor on Housing and Services at the U.S. Department of Housing and Urban Development. She is the Secretary's Senior Advisor in this area and works closely with the Department of Health and Human Services and across HUD to strengthen partnerships that will improve health and housing stability for residents of HUD-assisted housing. She's going to be discussing this emerging area of interest and the importance of bringing together a variety of providers and programs to make this effort a success. Welcome to you, Jennifer.
Thanks, John. It's really great to be a part of this webinar today. Thank you so much for the invitation to join you.
Quite welcome. And if we go to the next slide, as we start our conversation today, some of our audience may not be as familiar with the Department of Housing and Urban Development as they are with other federal agency programs. Could you describe some of the goals of the department for us?
Sure, John. Obviously, the heart and soul of HUD is about the nation's housing. And as you take a look at what's happened to the housing market over the last few years, over the last 10 years, I think it's been front and center in the news. And so one of the most important pieces of HUD's work is to make sure that we can strengthen the nation's housing market and really understanding the relationship between housing and the overall economy, and the critical role that housing plays in the economy. So that's job one. Also to understand that our housing market needs to be balanced and that we need both opportunities for home ownership, but also we need a quality, affordable housing rental market as well. The third strategic goal, and the one that I'm excited to talk with you today about, is this whole idea that housing doesn't stand alone. That the place that we call home, the place that we live, the place that we raise our families and where we socialize is a platform for our quality of life. And that used thoughtfully and strategically, housing really can be a way for us to deal with some of the most severe problems in society, like homelessness. But it also is a platform for young families to get on a path towards economic self-sufficiency and get good jobs. It's also just overall a way that no matter our age and no matter our condition, that home is a place where we really can stabilize and deal with fundamental goals, and that health is a critical one of those. Also, housing doesn't exist in a vacuum. It's a part of a community. And so at HUD, we really appreciate that housing is done in the context of community, and that by building strong housing, we're also involved in building strong communities. So HUD's role, while absolutely about housing, is about what it is that our homes enable us to do, and it's about the ways in which our homes are a part of the communities in which we live.
Thank you for that. As we go to the next slide, many of the programs that we work in aging are run by the Department of Health and Human Services, or HHS. what are some of the collaborative efforts that you're working on with them?
Since the very beginning of Secretary Donovan being in his position and Secretary Sebelius, his counterpart at Health and Human Services, the two of them sat down and realized that we need to be more deliberate about thinking about the ways that their services and our housing work together. And I mentioned before that we're doing this in the area of homelessness, especially around people who have severe mental illness, addiction, or chronic health conditions who are living on the streets. A lot of focus on veterans who have served this country and the fact that they deserve a home, but also families with children and youth, a growing problem in this country that we need to do something about. We do a lot of work closely with HHS and with states around trying to create more opportunities for people with disabilities and people who are aging to stay in the community instead of having to move into nursing homes or state hospitals or other institutional settings. There was a Supreme Court ruling back in 1999, and the case was called Olmstead. But what that really means is about creating balance in the system so that it's not kind of a given that people end up in hospitals or nursing homes, but rather that more of the healthcare system actually is focused on keeping people in their homes out in the community. And then specifically, the work on aging. And John, I know you know this as well or better than anybody, but as we watch the aging demographics in America, we really need to think long and hard about how is it that we help people age in place, as they say. How do we help people who do want to downsize and live in a smaller home, have a home that they can stay in and not something that isn't conducive to growing older there. And to have a system, a healthcare system that's set up so that we can provide the care and supports that people need to stay in their homes instead of having to move into institutions or move away from their community or their family or their friends in order to be where they want to be. And I think that's mainly what we're going to talk about today. But I think, the thing that I just want to underscore is that we at HUD understand that housing is a necessary precondition for people's health. And our friends over at the Department of Health and Human Services understand that exact same thing, that we're not going to be able to do these things in silos or in isolation, that we have to figure out how to work together strategically to help states and communities figure out how to make the housing and the health care come together so that we have housing stability, we have better health outcomes. But then what we're also finding is that's really tied to effective cost containment efforts, especially on the healthcare side.
Well, that's really great news because, of course, that has not always been the case, that there's been that kind of collaboration. But as we go to the next slide, we know that the need for housing for older people and for everyone is growing. Tell me something about the efforts about who needs housing in a way that HUD, the HUD department, is helping.
If you think about affordable housing in America, we really have this problem where the supply of affordable housing, so housing that is financed and structured so that people only pay 30% of their income towards their housing, that the supply of housing that's set up that way is decreasing. And yet the number of people who have the need for some assistance in order to keep their housing affordable is going up. And so, what we know, and I think it's on this slide here from our friends at AARP, is that there are 13 million low-income households with adults that are 50 or older that can't afford their housing, or they live in substandard or inadequate housing because it's all that they can afford. And you've got a large number of renters, 1.5 million households where people are paying more than half of their income on their rent. So we've got, a large number of people who just are paying so much more than they can afford, and that's growing every year as new households, as more people move into this part of the economic equation where their incomes are lower, and in many markets the rents are higher.
Right. I want to, as we move on to the next slide, I want to remind our audience that we will be having time for questions at the end of our presentation, and you can go ahead and enter them at any point. There is a box labeled questions on the panel on the right of your screen, and please go ahead and start typing in your questions now. I will be reading those later on, and that will be the second half of our discussion. So as we move on to the next slide, how are the growing numbers of seniors served by HUD programs?
HUD has lots of programs, and I don't want to kind of go into the technicalities of the difference of them, but just to talk a little bit about them. I think that most people have probably a historic vision of what HUD public housing is, and it's the some of the larger high-rise buildings that were put up, especially in some urban areas. That's kind of traditional public housing. Of course, a lot of that has changed the way that it's configured and the way that it looks in the last 20 years, but public housing is still a big part of what we do. Also, vouchers. If you go to your housing authority, oftentimes, you can get on a waiting list in order to get what's called a housing choice voucher, which is something that if you can find a landlord who will rent to you, the fact of the voucher is a contract between our housing authorities, landlords, and the tenants, so that you only pay 30% of your income towards your rent, and the government subsidizes the rest. We also have private market buildings or other affordable housing communities where some number of those units comes with that same type of contract. If you live in one of those units, you get help with your rent so that you're not paying more than 30%. Our friends over at the Department of Agriculture also have their own rural housing programs. And over at the Department of Treasury, sorry for the acronym here, it's the Low-Income Housing Tax Credit Program, which is basically a set of tax incentives that make it possible for developers to invest in more affordable housing. And then in addition to all these federal programs, lots of states and cities make their own investments in housing. So there are lots of different ways in which government provides tools for communities to have a whole bunch of different types of housing options. One of the things that we have noticed in terms of looking at who lives in HUD-assisted housing is that over time, at one point in time, it was low-income or working families and some people with disabilities and some seniors. What we're seeing is that a greater and greater percentage of the units are occupied by older Americans, and one of the reasons for that may well be tied to the demographic shifts that we're seeing nationwide. But when you get down to it, HUD provides housing for about 1 million very low-income seniors, and that's through our housing programs as opposed to the assistance people can get with their mortgages through the tax code and things like that. And about 1 in 3 extremely low-income seniors, so those with the lowest incomes, are receiving housing assistance from us.
As we move to the next slide, many people on this call are probably familiar with the Section 202 program, but could you tell us how that program serves seniors?
Yes, so Section 202 is really the name for one program at HUD that's been specifically created by Congress, and it's been around for more than 50 years in order to create affordable housing, but also housing with services, supportive housing for very low-income elderly persons. So across the country, there are about 6,700 projects, and that represents about 325,000 units of housing. And a part of the funding for some of these senior housing projects are service coordinators. So people that are there in the housing whose jobs are to help connect residents to the services that they need in the community. What we know about people who live in this Section 202 housing is that they're old. The median age is 73. They're very poor. The median income is just $12,600 a year. And, these are people who are medically frail or very much at risk for serious health problems. Over 1/3 have one or more disabilities. So the folks who live in the 202 program really can greatly benefit from that combination of financial assistance to make the housing affordable, but also the extra connection to services. But I think, the bad news at the bottom of the slide is that Congress has really dramatically cut funding for this program over the course of the last decade. So whereas there was $783 million that was being invested in 202 by Congress back in 2003, that number is now less than half, and there's about $356 million a year, at the same time that we're seeing the need for senior housing go up.
As we move to the next slide, we're hearing a lot these days about supportive housing. What is supportive housing? Is it only financial support like rent subsidies, or is it broader than that?
Supportive housing is really just that idea that for some people, it's more than housing that you need in order to be able to stay stably housed. And so it's that extra supportive service piece that's connected to the housing. We use the term supportive housing in multiple contexts. We use it for housing that's tailored towards individuals with disabilities who have been living on the street, people who are making transitions into being home again, and oftentimes having to get care for a range of issues that either developed while they were homeless or caused their homelessness sometimes. Supportive housing is a term that we use for individuals with disabilities who, but for the community services, might have to live in a more treatment-oriented community, a hospital or a group home. Supportive housing is a way to bring those services into people's homes to allow them to live in homes like you and I live in. So when we use it in the context of housing for older Americans, it really is in that idea that if you have some extra caregivers, if you have some people who are paying attention to the health and the service needs of residents, that can actually allow people to stay in their homes longer. It reminds me of when my grandmother was getting older, and one of my best friends from high school, Carolyn, was in grad school, and she needed a place to live. And she was able to live with my grandma for a few years while she was in grad school, and it also allowed my grandmother to stay in her home a lot longer, because even though they weren't doing stuff together all the time, and Carolyn wasn't around all the time, that extra watchful eye, somebody could take out the garbage, somebody could bring in the groceries, all those types of things just made it possible for my grandmother to stay at home longer. So it's that idea that when we can do kind of the right level of service coordination and kind of attentiveness to the things that help people stay in their homes, that actually what's happening is you're getting improved quality of life, but a lot of that improved quality of life is also about avoiding going to the hospital or avoiding ending up in the nursing home. So, one of the things that we've found is that when we have this service coordination in our senior housing, people actually can stay in that housing longer than they would if they didn't have that level of support. And that when that happens, you're actually, from a healthcare accounting perspective, not spending money on that more expensive hospital or nursing home care. So really thinking about the connection between housing and services, we think, is actually part of the healthcare equation.
Well, on the next slide, let's continue talking about that. And here you have some more specific information about how supportive housing improves quality of life and reduces costs. Could you tell us some more about that?
Sure. I'm sure that this has happened kind of in your own family and for many of the folks that are on the webinar today, where, a fall can lead to somebody ending up in the hospital that can then lead to kind of a decline in overall functioning, and can oftentimes be something that people just never are fully able to recover from. Or people get to the point where they're taking multiple medicines and have a pretty complicated prescription drug regimen that's hard to keep track of. And so taking the wrong pill in the wrong amount at the wrong time can lead to something that sends you to the emergency room or to the hospital. So thinking intentionally about how it is that we help reduce falls, reduce injuries, help people manage their medication, we think that can help reduce the Medicare and Medicaid costs of health care. And that's for people who have chronic conditions, heart disease, diabetes, asthma, all of these kind of chronic health conditions, functional limitations in terms of being able to get around, people who need support with any of their activities of daily living, folks that traditionally might be the highest cost to Medicaid and Medicare systems because they end up having something happen at home, going back to the emergency room, back to the hospital, back to the nursing home, that there's a way that we can do this better. And we took a look at a high-cost group, and what we found for a high-cost group of seniors is that the vast majority of their costs are around this hospital emergency room and prescription drug use. It's not because they're going to the doctor a lot. And very little was spent on home health. So how can we bring more care into people's homes so that we can improve people's lives? They don't have to spend time in the hospitals or the nursing homes, and that the healthcare system itself can help manage costs.
Right. So move to the next slide. What do we know about the impact of housing with services?
There's still a lot more research that needs to be done in this area. I think that it is still relatively new that people are appreciating the fact that your housing situation and your health status and the cost of care are all tightly connected. But one of the things that we're involved with, and if there's anybody who's listening from Vermont, you may know a lot more about this than I do, but we're involved in an evaluation of a Vermont program called Support and Services at Home. And this is really where a community health team is very intentionally coordinating care and services for people who live in senior communities. And it's really focused on the cost containment piece, but in terms of the experience of a resident, that means that somebody's there helping manage the way that you're discharged from a hospital and go back home, and what's happening during that transition out of hospital. Is somebody helping you understand, what it is that you can do to promote your self-care and your role in it, and helping coordinate. Maybe there's a couple different specialty doctors that you go to, as well as maybe still having an internist or general practitioner. So what we're doing is looking at a set of households in Vermont and then comparing them to some of their neighbors in New York, Massachusetts, and New Hampshire to really take a look at what the difference is for folks that have this health team, and then also trying to understand what the comparison is between people who live in HUD housing and have this support versus other seniors, low-income seniors, who may have the same need but aren't in a HUD-assisted program. So this is one example of kind of the closer look that we're doing at what happens when the healthcare system provides this community-based in-home care coordination, intentionally trying to help people stay in their homes and help them avoid going to the hospital.
We're coming to the end of our presentation part of this session today, but I want to remind our audience that you can go ahead and type in your questions under the question button on the panel on the right side of your screen, and please do so at this point. We'll be turning to that in just a few minutes. But as we move to the next slide, could you end the presentation part, I guess, by telling us what issues you're trying to better understand as you work to develop housing with services?
I think one of the questions that I'm asking really is, the term aging in place. What does that really mean, and what does it really entail? Does aging in place imply that people will actually move into some type of a senior community and then age in place there? Or does it imply that people want to live in the same communities that they lived in when they were younger, maybe when they were raising their children? I think that, that answer is going to be different for different people. But one of the ways that I'm thinking about this is as we think about the aging of the baby boomer generation, are they going to want the same types of housing and to live in the same types of communities as their parents do, or maybe that they want their parents to live in. And I don't think that we know the answer to that question, but I think that the way that we take a look at some of the other changes that the baby boom generation have brought to markets, I think that we should at least think about whether or not that's the case. Obviously we're doing a lot of work around the implementation of the Affordable Care Act and helping the healthcare system get its arms around how do we improve care, improve health, and ultimately lower the cost of care for everybody. So one of the questions is kind of, if you're somebody who's in the housing sector, if your job has been to create and operate housing, what does health reform look like to you? And what is it that's kind of coming that maybe isn't what you think about all the time, but health reform is going to change the way that you think about housing, especially for individuals with disabilities or seniors. But likewise, the healthcare system maybe historically hasn't paid that much attention to housing. And what does housing look like to the healthcare system? And how does the healthcare system want to think about, for example, access to housing? We at HUD have lots of programs that have lots of rules and practices around how people apply for and get on a waiting list to live in our housing. And it's not set up so that the healthcare system could raise its hand and say, we have a patient in the hospital who's been here 3 times in the last year, and it sure would be great if they could get into one of these supportive housing units because we think it could avoid the next hospitalization. So that's a lot of the work that we're doing with our friends at HHS, just trying to understand how our systems look to each other and how do we make our systems work better so that the housing and services fit. There's a lot of questions about who pays for what. And, where does health care end and resident services or tenancy supports begin? There are some health care programs where the healthcare system will pay for an in-home caregiver or respite care, so an in-home caregiver can get away for a while and get some time for themselves to come back, or will pay for household chores or other things that make it possible for people to stay in their own home. But a lot of that stuff doesn't sound like healthcare. It doesn't sound like an eye exam, an X-ray, or a pill. So where is it that the healthcare system and the healthcare system's responsibilities start and end? And when is it really more about the housing? Those are kind of big questions, especially when there's a lot of money and financial risk on the table. One of the things that we're thinking about a lot is that if housing actually improves health and lowers healthcare costs, but the healthcare system doesn't pay for housing, how do you deal with, what we call kind of the silos of government? How do you deal with the fact that you can't take savings that happen in one system and neatly reinvest them in another place? You can't take savings associated with reduced hospitalizations and have that easily convert into investing in more housing. And then, and I think the other big question, I think I started out my comments today with this, is that we're living during a period of time, really for over the last 3 decades, where we've seen nothing but a decline in the amount of federally supported affordable housing for all populations. And yet we're dealing with a period where there's a great demand. And how is it that we, begin to educate or begin to think differently about the role that the federal government plays in making housing available that's affordable to people who need it, and that it does some community good because that housing can really help manage some of the other costs that are borne by government, including Medicare and Medicaid. So those are the big ones.
Well, they are big ones indeed, and great to see and hear that you are working on all these big questions. As we move to the final slide, which is just the information to provide contact information, we'll turn now to your questions. And actually, the first one is really about the silos issue, and it's asking whether or not if I'm the administrator of a HUD-supported building, a Prac 202 building, for example, how can I share information about my residents across the HUD silo, the Medicare silo, and the Medicaid silo? I know this is something that you've also been investigating, and it's a difficult question at that level.
Yeah, I mean, privacy is really important, and there's a lot of laws that protect people's health information, and for good reasons. And certainly, if you were going to go and apply to live in a HUD building, you wouldn't want to think that the person that was making the decision about whether or not you got in was somehow taking into account your health conditions when they made that decision. But that said, if we're going to do good care coordination, and if the people who work in the housing are going to be good connectors to the healthcare system, then we have to think about how to talk across those systems. Yeah, I mean, I think that that people are finding ways to do it. I mean, a part of it obviously is that whenever an individual gives their consent for release of information, then there's more ability for people to talk across systems. But I think it's a real sensitive area in terms of thinking about how do we share information in a way that is still very, very protective of the privacy of individuals. I think that's going to be one of the big things that we see play out as we see more of these deliberate partnerships between healthcare systems and housing providers, and as we watch the evolution of the way that health information is moved across a network of providers that's coming with the implementation of health reform. I don't have an easy answer on that, but it's a good question.
Somewhat different question then. You talked about in your presentation the difference, you used the term both low income and extremely low income, with reference to the types of people that HUD has in its housing. Could you explain that difference, or either in terms of, dollar amounts or something else, or percentage of income? How is that distinction made?
So I don't have the numbers right in front of me, but let me explain to you the way that you think about it. The way that HUD thinks about income is through what we call the area median income, which is actually something that's different depending on which area you live in, but it's basically the average amount of the income of people that live in your community. And when we think about who different housing programs are targeted to, some of our programs are targeted for people who are at 60% of the area median income. Some programs are targeted at people who are 30% of the area median income, and you can imagine that that's a family that's living in poverty compared to their neighbors. And then people who are extremely low income are people who are at about 15% of area median income. And if there are experts on this who do a lot more with this than I do, go ahead and shoot in any technical corrections you need to that. But it's a technical term of art, and I can get you, John, the technical definition of that after the call.
But 15% of median income is low by any standard.
Extremely low.
This is a question that's related but a little bit different, and that is, to what degree is HUD involved in organizing services for either older adults or people with disabilities who need, basic services such as nutrition, transportation, and legal assistance? Is that something that you see the department being involved in directly, or is that something that you do in a collaboration with other agencies?
Yeah, I mean, I think it's something that needs to happen collaboratively. HUD shouldn't be in the legal services business or be in the transportation business, but we have a lot of collaborative work that we're doing with the Department of Justice, the Department of Transportation, as well as the Department of Health and Human Services, the Department of Education, in different ways. I think the big challenge that we're working on together right now is, if you take a look at the communities in which people live, is there a transportation infrastructure to connect people from where they live to where they work to the services that they need. And how can we help communities be deliberate and planful so that if you're doing new housing or if you're converting old housing, that you're thinking about the transportation needs and you're thinking about the location of services. And so, one of the things that we think about is that when we're putting money out for housing, are we asking those who are developing the housing to be asking questions about who are they partnering with in the community? I think that when we have service coordinators, when we do have the funding for them, or when our housing partners are finding a way to have service coordination on site, whether they're getting money from us or not, what tools are we putting in the hands of those service coordinators so that they can make the right linkages to services in the community and be able to bring those services in? I don't see this ever being all the money's in one pot and we're going to build communities where, you get a check and you can fund everything that people need. This is really more about figuring out how to make smart linkages between the programs that are out there and the services and supports that people who live in our housing want and need.
The next question is in some ways a follow-up but slightly different, which is you talked about providing services to those who have particularly chronic mental health problems in terms of the homelessness issue. But obviously there's lots of people with chronic mental illness who are in the community. And how do you get people who work in that sector and people who work in the providing services to low-income seniors to talk to each other about housing? There's typically a fair amount of reluctance on the part of housing providers to provide housing and services to this population. Are you working on that issue?
Yeah, absolutely. And I think it goes back to that idea of is it the housing side's responsibility or is it the healthcare and social services side's responsibility? I'm involved in this conversation all the time, and I don't want to make light of it, but it's kind of like this romantic comedy where I'll talk to the healthcare folks, and they'll say, our biggest problem is that we can't find housing, and then I'll talk to the housing folks, and they'll say, well, we've got housing, but our biggest concern is the people who need it don't come with services, and so it's like. You see this healthcare system kind of yearning for housing and this housing system that's yearning for home-based health services, and we got to get them together, And so I think that what we're starting to see more of that, though. We're starting to see that as state healthcare systems are figuring out how to provide housing options for people as an alternative to institutionalization. I think that we're going to see more of that as healthcare systems really have to take a good look at the people who are highest cost, have perhaps the most complicated array of both medical problems, behavioral health problems, but also social circumstances, and figure out how to reach past kind of the walls of the clinic out into the community as a way to manage the healthcare costs and the health outcomes that those systems are increasingly going to be accountable for. So, maybe it's just because I get excited about doing this every day, but I think that we're at a good moment in time where the tools that the healthcare system needs to be able to provide long-term services and supports for people in the place that they live, that when those services are available through the healthcare system, it takes the pressure off of the housing side and allows people who do housing to accept into housing people who, without those services, they might feel unclear about how it was that they were going to make it work for them. So I'm optimistic that we're seeing the types of changes that more and more of this is going to be happening because, frankly, it's the smart thing to do.
And the right thing to do.
That's right.
You've mentioned a couple times the idea of service coordinators located in housing. Is this something that you're seeing increasingly throughout the country? And is this something that HUD is paying for at this point or has intention of, or is this something that has to be provided through either the local community or other service providers?
Well, I'll send you back to the slide that shows that the congressional funding for programs like 202 is less than half of what it was 10 years ago. So at the same time that we might be wanting to do more and having a greater and greater understanding of the value of that, that hasn't quite translated into the political will to do more. But that said, there are lots of ways in which housing organizations, figure out a way to do this. And, I'd be remiss if I didn't say that's not an opportunity for philanthropic support, but I think with a long-term view is that how is it that local philanthropy and national philanthropy can help make the case for the value of that function, whether it's paid for through the housing sector, whether it's paid for through the social services sector, whether it's paid for by the healthcare sector, but that helping, instead of kind of just pointing that it's somebody else's responsibility, kind of helping us collectively see the value of the intervention and figuring out how to fund it in the long run. And I think that's really important. And I think the work around some specific populations, like people experiencing homelessness, people who have severe disabilities, and increasingly, I think, in the area of aging, we're getting better and better data to show that it makes sense. So the question is just, so how do we get systems to step up? And that's not just about, HUD raising our hand, but it's also about, the folks who make decisions about money to figure out how to make more and more of this possible.
Well, this is a pretty straightforward question after that one, and that is around the Section 202 programs. I have heard that 202 was defunded, and lots of people are saying that. Could you clear up any confusion on that issue?
Well, I think the question of whether or not there is more money to do more is a decision that Congress needs to make every year. And it hasn't been a given that there will be a new money for that program. HUD is asking. The president's asking for more money for the 202 program, but, we can only ask, and it's Congress's job to appropriate. So it's not like the 202 program is going away, but there has been a trend towards not making the same level of investments as we did historically. And like I said, at a time when, there's greater and greater need. I think, John, you and I talked about this a little bit when we were talking about doing this. It's hard in this political climate and in this economic environment to think that we're going to build enough housing to kind of, build our way out of this. And so it's a combination, I think, of making the case for more, but then also being very strategic in terms of how we use the housing resources that communities do have. But I also think it's about really broadening who's at the table saying that we need this housing. And if it's just, I don't mean to downplay it, but if it's only coming from the housing lobbyists, it's only coming from the affordable housing community to say we need more housing, that's not as powerful as if the argument for more is coming from people who are concerned about seniors being able to age in place over time, if it's not coming from, the center of the healthcare system. And, so my hope is that people see the fundamental role that housing plays in the way that we want to grow older and the way that we want to care for people as they age, and that we, really appreciate that that's something that we got to begin to invest in now.
Absolutely true. And I think this next question, as we come towards the end of our hour, is really about something that we haven't talked about, which is there is a great deal of emerging technology in the area of housing and supportive services, including things like remote monitoring and so forth. Do you see that involved in the conversations that you're having, and how do you see the role of emerging technology as being part of the way in which we might be able to keep older people at home safely in their environments?
Yeah, I mean, absolutely. And, yeah, we're seeing this a lot in terms of, people who live in rural communities and access to health care without having to drive for hours to some urban health center. That technology offers a lot of promise for what it is that we can make available. And if you just even think about how the adoption of Internet and other technologies across all populations and all age groups has really just skyrocketed over the course of the last decade. I think it's something that we can't even anticipate how much it's going to change our lives if we look forward another 10 or 20 years. I think the most important thing is that we not get locked into a mindset that we have to live in a certain place in order to have the supports and care that we need, and that care can become customized and more mobile, and that there are more options, so that decisions about where we live we can make independently from decisions about how we get care. And that's not necessarily the way the world is completely lined up right now, but I think that it's the direction that it's headed, and that means that we need to have ways to support housing that looks like everything from helping people stay in homes that they own, or for people to be building more universally accessible housing or retrofitting housing, in terms of having kind of different living arrangements in terms of in-home support, but also just having, if you are going to move out of your home and someplace else, that you're not limited in the options that you have, just because you're growing older and you need more services. I mean, that's really, I think, the vision that with HHS we're aiming for, is that people have choices, and that the choice you make doesn't limit the quality of care that you're able to get, and that you're getting the type of care that allow you to stay in your home for as long as you choose to stay there.
Our last question then relates to our primary audience here, which are funders and in philanthropic organizations such as foundations. And the question is, are there lessons that philanthropy can learn from experiences like the Vermont program, or other suggestions you may have about how philanthropy may be involved? You've talked to some degree about the role of education and advocacy. Are there other things that philanthropy can be doing?
Yeah, sure. I mean, I think the ability to convene locally or at a state level or even nationally to help these systems talk to one another, to support even smaller level, evaluation and research, data sharing projects in order to build understanding of how these systems are dependent upon one another. I think to be able to, a lot of, like I said, a lot of the supports that make it possible for folks to stay in their home on first blush don't look like housing or health care. They really look like the types of things that my friend Carolyn did for my grandma. And it takes a while sometimes to get those more flexible services adopted by the larger systems. And so I think to be able to use your position in terms of being able to speak to systems about change and about long-term value, I think that there's something there. I think being able to highlight places that are trying to do innovative work in these areas, that's really beneficial too. It's easy for folks to get their head down. The healthcare system's really busy trying to do reform, and sometimes I think as housers, folks feel a little under siege because there just aren't the investments that there used to be, and we're climbing out of what's been a pretty difficult market and, getting back on the right side of that. But, making space for folks to understand that the healthcare system isn't going to look like housing to bring healthcare into housing, and the housing system isn't going to change and look like an insurance model to bring housing into healthcare. That we've got to figure out something that's the best of both worlds, and having the long view and the patience to help the systems get there. I think that's really key.
Well, we had lots and lots of questions, and we will be sending those on, and we'll post some answers to our website later on. But we are approaching the end of our hour, so I wanted to see if you had any final words for our audience today.
Well, I feel like I've had an awful lot of words along the way, John, so I hope that you and your audience have been able to take something from our conversation today. I think that maybe the last piece that I'd leave folks with is that, when you get into the nuts and bolts of how HUD housing works, you end up with all these section this, section that, and acronyms. And same thing happens if you do a deep dive into healthcare. It can get complicated pretty quickly. But this isn't that complicated when you really think about what we're trying to do. We're trying to think about if you kind of redesigned a system from scratch so that people could live in a place that they could afford and live where they want to live and get the types of supports that would allow them to stay there and stay out of the hospital. What would that look like? And, in the midst of kind of the systems players who can get wrapped up in the technicalities of what they can and can't do and how they do it and all those things, I think that one of the things that you all really bring to that conversation is the ability to keep it real. I mean, this isn't hard. It's just the way that our systems have been designed over decades that sometimes make it so, and that there's a certain amount of common sense that can be applied to the communities that we're trying to create going forward. So.
Well, I want to thank Jennifer Ho, the Senior Advisor on Housing and Services at the U.S. Department of Housing and Urban Development, for her insights and expertise today. We want to thank her for everything she does to make life better for America's older adults. I also want to thank the John A. Hartford Foundation and the Retirement Research Foundation for their support of this program, as well as the American Society on Aging for their technical expertise. And finally, we want to thank all of you for participating in today's webinar. Have a great day.